want to welcome everybody to our NOACC semi-annual meeting. Welcome everybody who may not have been here in the past. This is our second year in a row. I think we're back at Kalahari. They do a great job here. For those of you who don't know who I am, my name's Tony Gallo. I'm the Director of Business Development for the Lorain County Chamber of Commerce, but I'm also in my second year as board chair for NOACC. So, yeah. Looking around the room, too, we want to make sure that we acknowledge Steve Petty, who is a member of NOACC through the Warrensville Heights Area Chamber of Commerce, for sending Matt today from New Image Media. We film these semi-annual meetings. There is an archive on the NOACC website. It's a great way to actually, if you are unable to attend one of the meetings or some of the people who couldn't be here today, it's a great way to see what you missed, what we talked about. It's also a great way for us to kind of keep track of what we've discussed over the years. So if you haven't been to the NOACC website lately, go check it out. If you were unable to make it to the semi-annual meeting at Great Lakes Science Center in October as well, too. We have over 32 chambers here today. We have a great, I guess, representation from across the state. If you didn't get a chance to introduce yourself to everybody at your table, make sure you do. You don't know who you might be sitting next to, but make sure you do take the chance to introduce yourself. We also want to take this moment to thank University CompCare. Because of their sponsorship, you are going to receive a $25 gift card on your way out today, hopefully to defray some of the costs of what it took you to drive here today. But I think gas is a little bit less this year than it was last year, so yeah, just a little bit. So I also want to introduce the member of the NOACC board at this time as well too. We have Liz Manning from Rocky River Chamber. She's one of our VPs. Jerry Vespoli from Springfield Township Area Chamber of Commerce. She's another VP. We have a couple of board members that were unable to attend today, but I want to introduce them no matter what. Heidi Inzerillo from the Streetsboro Area Chamber. We have Shirley Workman from the Akron Board of Trades, and our immediate past chair, Wayne Lawrence, from Beechwood Chamber of Commerce. So Wayne says hi? Okay, good. They volunteer their time, talent, and energy to NOACC. I appreciate them. It's not as much fun as it looks up here, so I definitely want to give props to the board because they actually make my life a little bit easier, that's for sure. I also want to introduce our vendors that are in the audience. We have Anthem Blue Cross Blue Shield. With them, we have Laura Ostrander, Debbie Boop, and Don Knife here today, if you guys want to wave. FedEx Partnership, Polly Myers. Independence Business Supply, Doug Broom. Caught Doug in the middle of a bite over there. Sorry about that, Doug. University Hospitals CompCare, Tarika Allen Bolden and Ann Grutner. And from our extra value program, we have Trent Milrun from Cloud9. So welcome, Trent. And at this moment, I'm gonna introduce, I believe Tarika's coming up to talk a little bit about University Hospitals CompCare.
Good morning again, everyone. Again, as he said, I am Tarika Allen Bolden, and I'm with University Hospitals CompCare. We're a subsidiary of University Hospitals Hospital. And as a managed care organization, anybody familiar with a managed care organization? He is, but a managed care organization, or you may hear the term MCO, is a business that helps the Bureau of Workers' Compensation do management of workers' compensation claims. Pretty much so we manage the claims for employers in the state of Ohio by transmitting the first report of injuries to the Bureau of Workers' Compensation. That would also entail making sure that injured workers or employees receive medical management when they're injured and they need to get treatment. And then we make sure that their bills are paid for them, any cost that occurs while services are being rendered. So pretty much so those are the things that we do as a managed care organization. And with that, I'll turn the floor over to
Thanks, Tarika. I think I said last year that when I first came into the chamber world, I didn't know what an MCO was. I didn't realize how important they were and how involved you can be and how people will belong to your chamber if you're able to offer them a really good MCO. And we're glad to have University CompCare on board again this year. So thank you again. We do have a little bit of business we need to take care of. We need to accept the minutes from our October meeting at Great Lakes Science Center. Hopefully a lot of you were there. We also need to approve our treasurer's report for 2012. I believe both of those were in the green folder. If you didn't get a chance to take a look at them, take a look at them now. They will be posted on the NOACC website. If there are any corrections, we'll take those at this moment. If not, we're going to just assume that they are accepted. We'll also take this moment to review the treasurer's report. I do want to point out a couple of things. We gave back to our chambers over $60,000 last year. Those were distributed through the funds that we received from Anthem, Benefits One Group, Independence Business Supply, and FedEx. If your chamber didn't receive any of those funds, you're doing something wrong. You definitely want to be a part of that $60,000 because like most of the chambers in this room, non-dues revenue is pretty important to us all. And I know $60,000 would benefit anybody, or any portion of that would benefit any of our chambers as well too. So with that, I'm going to just assume that our financials are accepted as well too, unless there's any questions on that. And we do have one chamber to approve. In case you were unaware of it, the Akron Board of Trades has actually split into two different chambers at this point. And we have a West Akron Board of Trade and a Southeast Akron Board of Trade at this point. So we do, if somebody could give me a motion to actually vote on it, hopefully somebody not from Akron Board of Trades. Okay, Jerry Vespoli. Thank you, Jerry. If we could vote on that with a signal of aye for yes. All right, well, welcome the two different Akron Boards of Trade to NOACC. So we are still 125 members strong, representing over 30,000 members within those 125 different chambers, and we are still the largest independent chamber association in the United States. So with that, I'm going to turn it over to Vicki, who's going to give us an update on all things NOACC.
Thanks, and I won't be that long. But we do have plenty of things that we're going to talk about later on, so we're excited about that today. So I'm so glad to see you all here, and I'm actually missing a slide. Oh, something happened to my, I'm actually missing a very important slide. Last year at this time, I don't know if you remember, I was expecting my first grandchild, and now we're going to celebrate his first birthday tomorrow. So I was going to put his picture up there so you could see him. I'm just a proud grandma. Anyway, let me give you a few of the things that we really want to tell you about. In your folders today also, we gave you the new Anthem literature. There's a flyer, brochure / PDF that you can use in your electronic newsletters. We also will have copies. We have a couple thousand here today, so if you want to take like 50 or 100 with you today, just let us know that you're taking it so we have kind of an idea of who has and who hasn't gotten them. But that's going to be great for you to let people know about this program, this ongoing program right now for the benefit of your members. There's also a new free quote form. It's very similar to the last free quote form. Again, it's a kind of a low-tech. Don Knife used to always say it was the best way of getting quotes because people just like to write something down and fax it or send it in. So I think it's still very effective. So those two examples are in your folder. So if you need more, again, I'll be sending out a kind of a email, sorry, to ask you how many more of those you'd like to have. And we can actually have the free quote form imprinted with your chamber's name on it. So I would recommend doing that because that's a great way for you to take credit for stuff and when you hand them out in your marketing packets and your new member packets and things like that. We had a little bit of a delay getting information out for this year's chamber marketing plans, but they're going to be getting to you real soon. Most of the chambers who have been concerned about it have called me, asked about it, said, what should I be doing? And basically, you're really advertising or promoting Anthem all the time anyway. That's, it's good for you, good for your members. But the specific plans will give you a chance to get reimbursed for some of those activities. So we will be sending those plans out to you, and hopefully we'll have a May 30th end date on it, and then we'll get the funds to you right after that. So I know some chambers are curious about that, but the money is good. You'll be getting that. But always be thinking of ways that you can add any of the vendors, but obviously if Anthem's a big important one to you, think of ways that you can add their name to either your website, your newsletters, whatever. That's why we have the new literature for you to do that. I think I told you all that. Oh, and the big one, which we're going to have a little example of it today. Don Knife and Debbie Boop from Anthem are here to present the Anthem Healthcare Reform Update. As you all know, healthcare reform is a fact. It's coming in to our life on January 1st. Some things have already been taking place, and your employers are already getting information and need even more information to make some of the decisions they're going to have to make next year. So their presentation is kind of a short version of what some of the chambers have already experienced in their areas, and they're still willing to do this through the summertime. So if you'd like to arrange for something at your chamber, what's really worked really well is if we group or several chambers in an area together, because that way, we did one just yesterday, we had like 80 people at it, and people were just amazed by all this information. So these guys do a great job, and I would recommend if you want to have something scheduled. By fall, it's going to get a little hectic for them, kind of busy. I doubt that they'll be able to do it in the fall, but through the summertime, it may still, or even like right now, if you want to get it done as best they can with their schedule. So please let them know. All right, then just quickly, I'm going to run through the rest of our benefits that I do want to talk about, because if we don't say something about it, I had a chamber complain to me the other day, you never talk about all the benefits. Well, we can always talk about it over the phone. It's always on the website. Anytime you want to have an in-depth conversation about it, please, I urge you, either I'll be happy to come out and visit, or we can just talk about it on the phone, or maybe your board members are interested. I could come and meet with them. So please keep that in mind, that that's what this is all about. But just so you know, Benefits One Group is our workers' comp group rating program, and they do offer your members a great opportunity to save money, real money, on their workers' comp premium. So there are a lot of groups out there. This is a great way for your members to have access to a fine group right locally and have wonderful service when it comes to penalty rated or any kind of issues they might have with workers' comp. So I urge you to, that's a real service to some people, because sometimes they just don't know where to turn. So having a good workers' comp group rating program like this available to them is a wonderful asset for you to offer people. So they'll get started with the marketing later on, probably mid to end summer. Look for those pieces of material. But if you'd like to have them come and talk to your chamber again to make a presentation, I urge you to do that, because you can never learn too much about workers' comp, whether you like it or not. There's a lot of information there. Hi, John. I see you coming in. Independence Business Supply offers your members savings on all their office supplies and services and generates income. I didn't mention this with, you know about the Anthem program a little bit and the marketing funds that are available, and I also forgot to tell you about workers' comp. There is a revenue stream that comes back to the chambers. We do try to look for those revenue streams, and Independence Business Supply is the third way that your chamber can make money. We had a chamber just within the last year went from receiving like a $35 check to a $350 check, and they're looking forward to having a $3,000 check. So I've had many chambers tell me that they need their non-dues revenue to increase. They're either their memberships are stagnant, or they're not getting enough in sponsorship. Non-dues revenue like this offers your members services, savings. They're saving money, and then you can make money on it too. So I urge you to look into those programs, and if you can offer it. Some chambers have other local providers, and that's great, but you can still offer two things side by side. If it's feasible, I would do it, because it really is a great savings program. And Doug's here today, so he'll be happy to talk to you about it if you want to have him come out and talk to your chamber. The the other more recent program that we added within the last couple of years is our FedEx program. And I probably have said more about them than anybody else lately because it's so exciting. People tell me all this all the time. Oh, I've been using FedEx and I didn't realize I could save this kind of money through our chamber. And we've got great reports on people saving thousands of dollars in some cases just by transferring their account that they've been using with FedEx over to this program. And then the chamber generates revenue on it also. So again, it's a no-brainer. Just all you have to do as a chamber, you can do two things. You can promote it without getting any residual. I actually have a couple chambers that say, well, I tell my members, but I don't want the money. I don't know, they could donate it. But at the same time, it does save their members a ton of money. So if you are making the money, then again, we have one chamber last year who got a check for about almost $400, I think it was. And that's only going to start to grow because he only had a small handful of people using it. So again, I recommend you taking advantage of these programs and any information you need about it. All of this information is on the website. And we, in our survey, asked all the chambers, how do they want to communicate better? How do we communicate better with you? How do you communicate better with your members? So we have some ideas about doing that, but it's really kind of up to you because if you don't tell them, your members, that you have these things, it's a secret. And I think it's a secret that we should really spread around. So that's probably the only thing I can ever say about the NOACC programs that disappoint me is that we don't have more people using them. These are so great. We work so hard to save you money and make you money and save your members money. Please take advantage of them because that's what a chamber does. So, the only thing I didn't tell you about was our extra value program. This is another really wonderful program. We initiated it about 2 years ago. And we still haven't seen a great deal of growth in it, but the potential is amazing. And again, from our survey, we had chambers saying, well, we don't have enough regional benefit providers in the NOACC program. Well, this is a great way for the regional guys to get involved because maybe a vendor doesn't want to go across the state. Maybe they're not a national vendor like FedEx or Anthem, but they could be local. Maybe they have a shredding service or a towing service or something. This is a great way for them to promote themselves to a region. And I highly recommend you letting your members, you know who they are, who might be a viable participant in something like this. They just pay a fee to NOACC to get the whole process going. But then once they get going, we look for them to have a residual for the chambers and also, again, a good savings program for their members. So, and Trent Milrun from Cloud9 is here today. Wave your hand, Trent, so everyone knows. He's got a great deal. I recommend all of you stopping and talking to him before you leave because he's got, and I can't even explain all of it, but he's got the voice over IP, internet services. He can give you free phones. Are you still doing that, Trent, by the way? Because I know a couple chambers took advantage of that. Free phone service, long distance, whatever, and a great modern technology. And again, if you promote it to your members, you get the free service for the chamber. So I recommend talking to him, and you can make some decent money on this too. I don't know if you have you had anybody generate revenue yet? Because I know you just got started within the last 6 months. Good. Okay. Well, Trent just got started last year with this, so it takes a while for things to start rolling, but it's another good opportunity for you to make money and help your members save money. So I think I covered everything I wanted to cover. I just recommend also, I do this all the time, we still don't do it enough, we need your testimonials. I want you to tell me what worked, what's been exciting in your area, even if it's not about a vendor, because we're going to do a little bit more about exchanging information with the chambers about what works in their chamber. But any kind of testimonial is wonderful information because in today's economy and day and age, we need to let people know how valuable joining their Chamber of Commerce is, and they should take advantage of the opportunities that are there. So we can't keep them a secret. We have to. Chambers typically don't blow their horns enough. We just really need to tell people what great things you're doing. And so if you share them with me, I can share them with the world. As our website gets more traffic, that'll always be a good thing to have. And then share them with each other. Make sure you put a testimonial every month in your newsletter. Those are great ways for people to understand the value of their chamber membership. So. Okay, I could just keep on talking since somebody gave me this mic, and I won't do that. So thank you again for all your support and help, and I look forward to working with you again this year. So thank you. Oh, wait a minute, Sheila.
This is a question maybe we can address one-on-one, but we'd like to get some input. I now have 2 or 3 local companies offering things like office supplies and other things like that, and they're giving me a lot of flack about, don't be promoting that. And how do you...
This is a chamber-by-chamber decision. This is a chamber-to-chamber decision. If it doesn't work in your area, NOACC was always about what works for you. So if it doesn't work for you, then you don't want to make your members mad. Of course not. I usually tell people that many times those people are not necessarily shopping with them. They're shopping somewhere else, and at least you're keeping this local, as opposed to them shopping online and buying their office supplies from out of state. At least this is a local company. But this is something each chamber makes a decision. That's why we ask you that question. Do you want to promote all of them, just some of them? I've had many chambers tell me that what they do is say, well, these are the separate NOACC benefits. We let you know about them because we belong to NOACC. It's a bigger organization. Purchasing power is greater, but they don't necessarily promote it independently themselves. And most of our vendors are really, we're all working together to achieve the same thing. So if the chamber doesn't promote it, then there probably would not be a residual. And that's true even for Anthem. If the chamber has to have this as an exclusive for Anthem, but if they don't promote it, they don't get any residual from any of the programs we do. Same thing with the IBS and with FedEx. So it's really a chamber decision. I mean, I wish I could give you a better answer than that, and then many times it's a board decision in your chamber. When I say chamber decision, your board may want to take a vote on this, and then you have a policy in place. But it's really up to you. So, but if I can help you in any way, let me know. And the other thing, make sure you do have a conversation with that member. That's the one thing that I hear this a lot. People say, well, we have a member that sells office supplies or has a UPS store, and so we can't offer those programs. Well, that may be true, but I would check with that member because many times they kind of like the competition. They respect the competition, and they like being able to say, hey, but we're here in town. So it gives them an opportunity to promote themselves, too. So I do that. Yes, Jim.
Yeah, a number of the people there I couldn't see. Could you ask each of the people who are representing these groups to stand, give their name and who they represent, so the rest of us can see them?
That'd probably be a great idea. Can we do that later? Do you want to do it now, or you want to do it before we get started? Okay. Oh, you talking about the vendors? Oh, okay. All right. Well, let me walk over here and point them out to you. Debbie. Well, she's actually going to come up pretty soon. We just want you to say hi.
Oh.
Say hi.
Hello, good morning.
She's going to be talking soon.
Oh, I'm sorry. Thank you. My name is Debbie Boop, and that is my real last name. I'm not related to Betty, and I do know many of you because I've had the opportunity to come out and talk at your chamber, so thank you.
I'm Don Knife with Anthem Blue Cross and Blue Shield. I work more in the Cleveland area with the smaller groups, and I've been associated with NOACC for many years now.
At least 18, maybe 20. What happened? Laura was just sitting there, but she walked up. There's Laura.
I'm Laura Ostrander. I'm with Anthem Blue Cross and Blue Shield too. Debbie and Don and Nancy Kazenko, they're your salespeople, and I'm your marketing person. So I do a lot of the flyers, brochures, changes, that kind of stuff. So we're all three of us are kind of in the independent office, but I service the whole state, and Debbie does a little bit of the Northwest, and Don's a little bit of the West.
She's my first go-to person, and then everybody else backs her up too.
Hi, I'm Polly Myers. I'm from Partnership. We provide the FedEx discounts for the chambers and your members, and we are located in Westlake, Ohio.
Thanks, Polly.
Doug Broom with Independence Business Supply. Just come and see me. I'll explain our rebate program where the chambers can earn up to 3% back on their members' office supply purchases as well as their own.
Yes. Yeah, if nothing else, chambers are buying supplies, and I have a lot of chambers that are saving money on top of the money they're saving because they're getting a residual back on it.
Thanks. Trent Milliron with Cloud9, and we do business class voice over IP services for small businesses. So that's all we do.
Don't be shy. This is your group. These are your people. They want to buy from you. You want to give them things, free things. All right. I think we're ready to move on. That means, Tony, you come back up here. We're going to put the music back on and get everybody start to sing next. Hold on, I just make sure.
Are we doing?
Thank you all.
Thanks, Vicki. Okay, at this point, we are going to have Debbie Boop come up, and we're going to give you I guess, the condensed version of the Anthem healthcare reform update. And Don, I think, is going to be helping Debbie as well, too. So with that, I'm going to turn it over to them. And
Debbie Boop is here with us today. Debbie covers the northwestern part of Ohio up in Toledo with mostly large group. I, Don Knife, still cover the Cleveland area with a lot of the smaller groups. So today we're going to go over the healthcare reform issues that are current. I'm going to kind of focus on the smaller groups. Debbie's going to focus on the larger groups. So we kind of have everything covered here. The healthcare reform law has been fairly squishy. Almost weekly, a couple of weeks or so, there are additional guidelines that are released by the government. There are changes released to guidelines that were previously put in place. There are items that are postponed and moved to a later date that were previously put in place. Things like the requirement that you notify your employees of the exchanges, for example, was postponed from the spring until sometime in the fall. The individual choice option that you were going to have on the shop exchange, for example, was postponed until sometime in 2015. So these are some of the kind of issues that are going on. It's a very kind of cloudy, difficult thing to get your hands around. This slide kind of gives you a look at what our expectation is for over the next 3 years as to what's going to happen. In that left-hand column are the uninsured individual plans, Medicare plans, Medicaid, large group, small group, et cetera. You can see that we would expect the uninsured to drop significantly by more than half by the year 2016. The individual plans, again, are going to increase significantly. Medicare will stay about the same. Medicaid will increase significantly. The Medicaid eligibility is going to go up to 133% of the federal poverty level, which is going to allow a lot more people to be on Medicaid. Small group is going to shrink. Large group and self-insured plans are going to stay about the same. If you're an individual, what you can do, you can either go to your employer's health plan, you can buy a plan through the exchange, or buy a plan from an insurance company off the exchange, or you can buy no coverage at all and just pay the penalty. That penalty for the first year in 2014 will be $95 or 1% of your gross income, whichever is more. So if you're making $50,000, it'd be about $500. What most people are probably going to end up doing is weighing that cost of the penalty versus the cost of buying the insurance. On the exchange, you will have access to credits and to subsidies. These credits will be a reduction in the amount you pay for the coverage. So if the coverage costs $500, you may be able to get a credit for $250. The subsidies will actually lower the out-of-pocket amount. So if you're looking at buying a plan that has a $6,000 out-of-pocket, it may only have a $2,000 out-of-pocket. So a combination of those subsidies and credits are available to those who qualify. In order to qualify for these subsidies and these credits, to be eligible, you have to have an income between 133 and 400% of the federal poverty level. If you look to the right there in that box, those income ranges of 133 to 400%. For an individual, that would be $14,856 up to $44,680. For a family of four, it'd be $30,656 to $92,200. In order to get the subsidies, you have to have you have to have minimum health coverage through an employer. You cannot have minimum health coverage through an employer, and you cannot have coverage that's unaffordable. Otherwise, you're allowed to go to the exchange and get the subsidy. This next chart, the interesting thing about this chart is you can see on the left-hand column are the group sizes, so less than 10 up to greater than 1,000 employees. But you can see that from 133 to 400% of the federal poverty level, you will have significant people in all size groups that are going to be eligible for those subsidies. So as an employer, you want to pay careful attention to that and work with your employees and work with your brokers to manage that. Open enrollment period for individuals is going to be on the exchange will be from October 1st until March 1st of 2014. Now, I've heard recently that the insurance carriers are going to be allowed to do the same thing off the exchange, and Anthem is going to be offering an open enrollment period for those same dates. That's just for the first year of healthcare reform. After that, the open enrollment period is going to be the same as it is for Medicare. Come January 2014, there will be no longer any medical underwriting. There'll be no longer any people being rated up for medical reasons. So you'll have community rates, you'll have guarantee issue for everything, individual and small group. The plans won't be allowed to differ cost-wise by a ratio of more than 3 to 1. In a state like Ohio that has always had medical underwriting, this is going to be a huge difference. For certain groups, this is going to cause a very large rate increase. For some groups, this will cause a rate reduction. These are the functions the exchange is going to perform. Of course, a lot of these things now are done by the insurance companies. The exchange is going to charge a user fee to manage all this. That user fee on the federal exchanges, I'm hearing, is going to be around 3.5%. That 3.5% gets charged to the insurance companies and the other insurance organizations using the exchange, and of course that gets passed back to their customers. Under healthcare reform, the plans all have to conform to either platinum, gold, silver, bronze, which corresponds to 90, 80, 70, 60% actuarial value. So if you took the essential health benefits that are required under healthcare reform and took a typical plan, the platinum plan would cover 90% of those costs, whereas the bronze plan would cover 60% of those costs. So the bronze plan would be lower cost to you, the platinum plan would be the highest cost to you. These are the 10 essential health benefits that healthcare reform requires all of the insurance companies and anybody selling insurance plans on or off the exchange to provide. This is the SHOP exchange for small groups. SHOP stands for the Small Business Health Options Program. And one thing to note here, the first bullet point there says, buy any product on the SHOP within limitation. The original formulation for the SHOP exchange was that the employer would go in and pick the metal level, so platinum, bronze, silver, gold, and then the employees would go into that metal level, pick whatever plan they wanted with whatever insurance company they wanted. The exchange would aggregate all that money, send it out to the correct insurance company. That whole idea has been postponed. I think there was a feeling that they were not going to have the sophistication and the time to get it set up to accomplish that, so it's been postponed. The federal exchanges have postponed it until 2015. They've given the state exchanges the right to do it as well. They probably also will postpone it until 2015. This graph kind of gives you an indication of how things are handled for individual, small group, large group. One thing to note here on especially the small group, there's a notation that says not grandfathered plan, not GF, which stands for not grandfathered, non-grandfathered only. I should point out that in the Cleveland marketplace with Anthem, there are no grandfathered plans. We have made changes to the coverages over the years that have created a situation where there are no grandfathered plans left. Taxes and fees, The first one that you see up there is the PCORI fee, the Patient-Centered Outcomes Research Institute fee. That fee started in 2012. It's already baked into your rates with Anthem. If you have an Anthem plan, that's already been put into your rates. The tax on high earners and unearned income is on the individuals, and that's occurring already in 2013. The insurer fee and the reinsurance fee, these two costs, if you have a plan that's renewing after January 1st, 2014, these taxes have also been prorated and already built into your rates. So they are affecting your costs. That's what I had at this point. At this point, I'm going to hand off to Debbie, who's going to go over more of the large group side of this.
Question. I know that you folks are making presentations at different groups of chambers now, and I'm aware of that. If somebody wants to bring that in, will they not only make the presentation, but give them the same data printed out so that somebody can take that back with them? If they do make a presentation on that?
John, open it up. So, if you don't mind.
Yesterday at the Middleburg Heights meeting, John Cooper, our vice president, did allow for us to distribute some of the slides. Keep in mind that this is an Anthem branded program. We're giving you the information. It's not intended to be a commercial, but we also don't want it just handed over to our competition either. So we are distributing the presentation on a limited basis. If you want a presentation to your chamber members, coordinate that through Vicki. We are happy to come out and offer this presentation to you. Some of you in this room have already heard this same presentation, and we thank you for that opportunity. We feel that the more folks that are hearing this from you not only reinforces the value of what you as a chamber bring to your members, because everybody's got a slightly different spin on this. Everybody's talking a little bit differently about the Affordable Care Act, but we want to make sure that we're providing additional resources. Now, we've been able to recently provide some handouts. I know Vicki's been sending out some articles for you to use as a chamber regarding the Affordable Care Act. So again, please reach out because we need to get the coordination of these dates sooner rather than later. As Vicki mentioned, we're willing to do these presentations through the summer. We've been put on notice by the senior management that there will be no paid time off from October 1st through the end of the year. Now, if you remember Don's presentation when he talked about when the open enrollment period begins, October 1st. We are expecting a flurry of quote activity starting October 1st, well into 2014. So it's going to be harder for us to get out of the office to do these types of presentations after October 1st. Up until that point, really mid-September is where we're trying to cut off. So again, if that's something that would be of interest to you, of value to your membership, please talk to Vicki. We're getting those dates on the calendar. We've already got several scheduled for August. And actually, that'll probably be a much better timeline than now, just because of the timing. By August, we should have a good idea of what our products are going to look like, what our pricing may look like, have some better feel for how the exchange is going to function in Ohio. So again, coordinate with Vicki. We want to get out in front of your members to reinforce that value that you bring to them. Okay? So with that said, I'm going to talk about the large group mandate. Now, large group, by definition, according to the Affordable Care Act, the small group went from 1 to 99, but the state of Ohio determined that we want to keep the small group in the 1 to 50 market segment, which when you look at some of the pay or play provisions, it's actually 1 to 49. Now in Ohio, a small group is considered in the 1 to 50 market segment. Starting 1/1/14, if you have 50 or more employees that qualify for benefits, you are now considered a large employer and, drum roll please, subject to pay or play provisions. And we're going to go through that. Don, if you would. What is the large group employer mandate? Well, basically the mandate is intended to make sure that large employers 50 or more full-time equivalent employees are offering affordable benefits at a minimum value to all employees. If you as an employer decide that you're not going to offer all of your full-time employees the minimum value of 60% and affordable, and we'll talk about what that means in a minute, there is a penalty that you will pay for every full-time employee. That penalty is equivalent to $2,000 per employee per year. Now, with that, you get to remove the first 30 employees. Don't ask me where that first 30 exemption came from. I have no idea. But bottom line is, you now have to make sure that your plan is compliant with the provisions of the health care law. And that kicks in at your first ERISA renewal date. This is not your health plan renewal date. There's been some clarification on that recently. But your ERISA plan year after 1/1/14, on or after 1/1/14. Go ahead, Don. Now, one of the strategies that a lot of the employers were talking about is, well, I've got a location here. You know, I'll use my territory, Northwest Ohio. I've got a location in Findlay. I've got a location in Toledo. I've got a location in Tiffin. Well, I'll just set them up with all separate tax ID numbers so that each entity is under 50 employees and I can avoid it. Wrong. Under the controlled group rule, Internal Revenue Code 414, if there is common ownership as defined by that rule, you have to aggregate all your employees and count them as one employer group. Now again, if you have a specific situation that you want to review, we're telling folks, talk to your consultants, talk to your brokers, talk to your attorneys and accountants. We as a carrier are not in a position to tell you whether this applies or not, but the experts are. So again, if you have questions about that, please talk to the experts. Next slide. Now, this is where it gets really tricky on the large group mandate. You may be considered a small group employer today, meaning that you have only 20 full-time employees that by definition are eligible for coverage today. Starting with your first renewal in 1/1/14, you now have to aggregate all your full-time employees with your part-time employees, do a calculation based on your part-time employees' hours, and you may today be a small group, tomorrow be a large group. This is going to be very important, especially for those folks that have a lot of part-timers. If you've been, or you've got a seasonal workforce, there's very specific provisions that are going to apply to you. You need to make sure you're working with reputable resources that are able to help you figure this out. Brokers, consultants, actuaries, attorneys, they're all out there and they're gearing up to help you with this. So I was actually talking with a couple of folks over the last week in Northwest Ohio. Many of the brokers are actually purchasing software to help illustrate to an employer what the impacts are going to be, help them aggregate these full-time, part-time employees, and determine the costs of what is the penalty versus what does it cost to maintain your health insurance program. Next slide. Now, the large group mandate, this is just a quick summary. Again, there's different regulations that are popping out on a regular basis. One of the provisions was instead of mandating 100% coverage to all full-time employees, they've got a 95% rule being offered, and it's the employees and their dependents. One of the strange clarifications that came out, this is one of the regs, dependents includes dependent children. It does not include spouse. Again, don't ask me where that came from. Now, we do have a lot of employers that have employees that are working, they have spouses that work. And the spouse waives off the coverage, they jump on the employee's plan when, in essence, they should be having coverage with their employer as opposed to dumping on your employee group. So I think that was part of the logic, but from a carrier perspective, we're not looking at dividing those contracts out yet. So don't panic. It's not like we're only going to offer employee and employee children plans. It's just that was one of those quirky things that came out in some of this clarification. So if you don't offer the coverage Again, the penalty is $2,000 per full-time employee minus the first 30. Next slide. Now, if you have a situation where you as an employer are offering the coverage, however, it is either not meeting the minimum value or it is not deemed as affordable, and one of your employees goes into that exchange that Don was referring to, they qualify for a subsidy, you as an employer will be penalized $3,000 for each employee that does that. So it's critical for you to understand these laws, because you could inadvertently get hit with this bill not realizing it if you're not paying attention. And that's why we're telling folks, listen, you need to be talking to your brokers, your consultants, your accountants, your lawyers, getting a good handle on how this is going to impact you. Now, there are some safe harbor provisions, and these are very important. Next. Okay, this just reiterates what you have to offer as a large employer. That 60% minimum value plan, remember when Don referred to the metal plans, platinum, gold, silver, bronze, it has to be at least that minimum bronze level. And again, there are calculators that you can access either through HHS, Health and Human Services, or through your brokers and consultants that will help you determine if your plan meets that minimum actuarial value, and your plan has to be deemed as affordable. Affordable, according to the Affordable Care Act, is 9.5% of an individual's income level on their W-2. Now, the way the law was originally written is it's 9.5% of the family income. Well, how are you as an employer supposed to know what their family income is? And this was one of the first complaints that was coming out is, okay, I'm an employer, I'm running a business, I'm paying my employees. How am I going to know what the total income is? So again, there's safe harbors. The 3 safe harbors that are out there is that an employer can test against their lowest paid employee if their lowest paid employees, box 1, take their employee contribution, as long as it's 9.5% or less of that box 1 total, that's a safe harbor. You will not be charged the $3,000 penalty if your employee goes into the exchange. Another one, the rate of pay safe harbor. This has to do with hourly employees calculating their total income and then applying that same test. The federal poverty level basically states that as long as the employee contribution is 9.5% or less of the federal poverty level. And again, Don showed you those on the subsidy slide. Those are 3 different provisions of safe harbor. Again, questions, please talk to your consultants and brokers. Next. Automatic enrollment provision. This has been postponed a couple of times. We don't know if this is going to get thrown out or just postponed indefinitely, but bottom line is it's a provision of the Affordable Care Act that says you as an employer have to enroll an employee when they walk in the door. Now, you've got up to a 90-day waiting period that you can apply, but the employee actually has to physically opt out of the health plan if they don't want it. A lot of employers are already doing this for their 401k plans to try to increase that participation level. So it's just one more thing to think about. Again, that provision has been postponed for now. Next. Miscellaneous provisions. I love this one. A lot of folks think, well, if I'm in a union and my union contract isn't up for a few years, I'm good. No, you're not. Talk to your consultants, talk to your attorneys, because this does apply to you. This is probably my favorite statement. If the employer is liable, the IRS will let you know. Really? That's kind of a scary thought. But bottom line is, you've heard me say this over and over and over again. Please talk to your trusted advisors. Your brokers, your consultants, your attorneys, your accountants. They are there to help you. They are there to make sure that you're not going to get hit with something unexpectedly. Next. Now, what the Affordable Care Act doesn't address is affordability. I'm not going to get into a ton of this because I know we're running short on time, but part of what we do when we come out and do these healthcare reform presentations with you is show there is an upside to all this. And I know that's kind of hard to see once we talk about taxes and fees and subsidies and all this other stuff. But what we see, This particular slide shows the average cost for a 2012 hospital stay in the United States. Now, you've got the 25th percentile sitting at $1,500. The next highest is Australia, $1,472. Our average is almost $4,300 per day. Now, if you look at the 95th percentile at $12,000, that's a little mind-boggling. This is the stuff the Affordable Care Act does not address. So on the carrier side, we are having to become more creative. And when I say we, Anthem has some very innovative programs. Other carriers are coming up with programs. Can you flip real quick, Don? I just want to show them real quick. You can skip over this one. We have imaging redirection programs. We have reference-based medicine that we're going to. This is one that's really cool and we're getting a lot of feedback on. You may be hearing this from some of your brokers and consultants that are talking to you about it as well. Online doctor visits. You need a webcam. You can log in 24/7. And this system is integrated with your health benefits. So if you have a $20 office visit copay, you'll pay $20 for this online visit. If you have a high deductible health plan, the full cost of this service is $49. And that charge goes right through your benefit program and applies to your deductible, or if you've met your deductible, it's paid by the plan. Now, obviously, this isn't going to work for everything. We're encouraging folks, you still have to maintain that relationship with your primary care physician. It's very important. But this is some new technology that's coming out as a result of we can only charge so much. Our loss ratios are dictated by the government. We can't make excessive profits. And that's okay. That's okay. But we still have to address the cost of care. And so this is one tool that we're rolling out. And again, I keep hearing the launch date of July 1st. Now, this is for Anthem members. Other carriers have different solutions. You have to watch what's out there because some have fees, some don't. Talk to your brokers and consultants. They'll help you figure out the best solutions for you. But this is really, I think, getting to the crux of what healthcare reform needs to be, and that is controlling the costs of care. So again, if you'd like to have this presentation brought to your local chambers, we are more than willing to work with you to help you provide these resources. We have some Anthem branded handouts that talk about the employer mandate. We have a summary sheet that shows you provision by provision, who it applies to, individual, small group, large group. Any questions at this point? Yes.
I have a question, and I've been trying to figure out from everyone's different presentations, and I guess it's more of a personal question than for my numbers. But my husband, our health insurance, we're a large employer, and we're above 400% poverty line. But I don't like our health plan. I mean, I love when 5 years ago Anthem was talking about the 5 different ones, and one employer offers 5 different plans to employees. I'm disappointed that never fully came to fruition, but it's coming back. Yay, good. But this exchange program, I mean, for someone like me, because our plan's 70-30, and I want 80-20 or 90-10 or 100%, and I'm paying for it, can I go out to the exchange now when it comes and, I mean, I'm not underinsured, I'm not anything else, but am I allowed to go get insurance plans off of there? Because right now, I'm stuck with whatever my employer, my health employer gives them, and it sucks.
You'll actually have two options. Don mentioned it when we first started the presentation when he was talking about the individual options. You can maintain your coverage through your employer. You can go to the exchange, which will be the public platform, but based on your income level, you're probably not going to qualify for any subsidies or any cost offsets. Or you can buy off the exchange, which will allow you some different options, but again, you're not going to get that subsidy. I think the biggest thing you need to consider is, first of all, that health benefit that you receive through the employer is tax-free to you today. When you go outside, it's all on you. And that's going to be after-tax money that you're paying for that health insurance plan.
employer's money and go spend it on the exchange. It'd be like as if I went and bought a personal health plan right now anyways on my own.
Exactly. Exactly. And again, these are some of those regulations that are coming out because initially there was a thought that employers could do that where they could just give a bucket of money to their employees and turn them loose in the market. The IRS came out with regs, no, it was HHS. HHS came out with regs late in 2012 that said you cannot do that. Yeah. And again, there's more regs coming. What Don and I shared with you today is what we know as of today. Every time you pick up that newspaper, there's more information coming out. Please, please, please get your information from reputable sources. There is so much misinformation out there right now. You probably saw a very reputable source said the shop exchange is postponed to 2015. Well, that wasn't exactly accurate. Provisions within the shop are postponed, but not entirely. Yes?
Are the premiums going to go crazy sky high because you're not doing the medical evaluation, so you have to make up for people that are going to be really sick versus people who aren't? People who don't ever go to the doctor, are they going to end up paying more to cover that cost of the people that always go to the doctor?
There's actually two schools of thought. First of all, for the larger employer market, we'll still be doing medical underwriting in the 50 and up, and that goes through 2016. For small group and individuals, here's what's happening today. In Ohio, we have low cost, low risk individuals. We have higher cost, higher utilizing individuals. So we've got a very wide range of rates. With community rating, it goes like this. As Don mentioned, we can only have an age band of 1 to 3. So your 24-year-old versus your 64-year-old can't be more than a 3-to-1 ratio. We can rate based on zip code. And actually, that's not a bad thing because there are higher cost areas in Ohio where your costs are going to be much greater than maybe a different area. So we do have the ability to look at that. In essence, what's going to happen, it's like a teeter-totter. You've got your healthy, low-cost folks here, your unhealthy, high-cost folks here, like a teeter-totter. It just goes right in the middle. Oh, wait, there's taxes. So this is, in essence, what's going to be coming as of 1/1/14. Now, we on the carrier side are trying to figure out strategies to help mitigate some of that expense. You've probably seen crazy numbers reported in the newspapers. John Cooper mentioned yesterday at our presentation with Middleburg that he's seen the American Actuarial something. They were saying the individual market will experience about an 80% increase. We're not seeing quite that much. But again, time will tell based on the plan designs that are issued and the rates that are approved by HHS. So again, we'll have more information later this year what that actual rate impact will be.
But generally, if you're younger and healthier, versus older and sicker, the younger healthy folks are going to see their rates increase.
Right, and that's what I'm getting. So then that exchange or the program where it's based on your income, is that a way to get that premium back down to where you're used to? I guess I'm thinking for myself, my employer doesn't offer insurance, so right now I buy my own. So you're telling me in January my premium is going to go like this. How am I going to afford that?
And that's where the federal poverty level subsidies will have to kick in. And if you don't qualify, keep in mind, not everyone's going to get that same subsidy level. It depends on your income. So if you're at 134% of federal poverty, your subsidy is going to be a lot greater than if you're at 399% of federal poverty.
What if you're under that? Just a curiosity. What if you don't fall? Because I noticed like some of those ranges. What if you don't fall into that range? If you're a family of 4, so the minimum was $30-some thousand. What if you don't fall in that? What if you're below that?
Well, that could be covered under the Medicaid expansion if Ohio decides to go that route. Now, as you know, initially Governor Kasich said, yes, we want to do the Medicaid expansion. They've since backpedaled. When he introduced his budget, they pulled that out. So we don't know right now what's going to happen with the Medicaid expansion. I know that's in talks.
Well, and I think a family of 4 can earn up to around $90,000 some and still qualify for some level of subsidy.
There was a minimum. I mean, I'm just saying that doesn't apply to me, but I mean, some people, I do know someone who, they're not even going to meet the minimum, the 133. So what if they're below that?
Then they're on Medicaid.
Oh, okay, okay. So that's the breakoff is there.
Right.
Mm-hmm.
Okay.
Right.
One more.
Jim.
We got 2 more.
You know, the one thing that came up, Don and I went to a meeting together with a group of health underwriters, and during that there were 2 people from a law firm locally who were making a presentation. And they said in a 1-month period in early 2013, they had to make 5 changes in their presentation. The level of changes that are happening in this is so huge that unless you're getting the very, very best information, you really can't stay up with it. And we've discussed that in some way.
Yeah, if you saw a presentation on this kind of thing a year ago or 6 months ago, it's a very different presentation now because of all the changes that have occurred.
Take one more question.
One more, and we'll keep wrapping up.
You know, that's what you covered. I know you were talking about with the large food 50 plus, with the employer don't provide insurance, there's going to be a penalty. What about the small, so not an employer of kind of stuff?
If you work for a small employer or if you manage a small employer today, and again, it's in that 2 to 49 range, you don't have to provide coverage to your employees. But there's nothing keeping you from offering it today. Why do you do it? And this is a discussion I have when I come out and I talk to the various chambers. You do it to attract and retain good help. Is that going to change after 1/1/14? And competitively, you need to think about this. If there are 6 auto body shops that you compete with in a local market, one of them decides to drop coverage and pay their employees an extra $1 per hour, is that going to be enough of a draw to pull your good talent? Or is that going to be seen as a negative? Because again, today, a health insurance benefit that's provided by the employer, tax-free to the employee, tax deductible for the employer. So again, these are all considerations, and the brokers and consultants out there are gearing up to have these very conversations. There is no penalty to a small group employer. But again, do that part-time calculation because you may think you're small, but you might not be. Folks, thank you for your time.
Thank you. Thank you so much, Debbie and Don. They're going to adjust the screen for us, and you can see now how complicated the subject is. We really literally could go on for a couple hours, but we want to do other things. So, Tony.
Yeah. Obviously, if you have the chance to have them present this for your chamber, for your members, you can see how complicated it can be. You can see how overwhelming it is, and really take advantage of it. Call Vicki, try to get something set up. I know we've had these done several times throughout the state. Take advantage of it. Make sure that they come present for your chamber or get together with another group of chambers, because there is so much information. And I know it's hard to not think of yourself in this, but times that by all the members that you have in your chamber, and you can see the questions that would come up. And one of the reasons we decided to proceed with this today was because obviously there's a huge change coming on January 1st, and how that affects your chamber. With a lot of our members and a lot of the people who belong to your chamber belong to the chamber because they get the discount through Anthem. If that goes away, we obviously need to take a look at, as your chamber, as your chamber organization, how's that going to affect NOACC? How's that going to affect your individual chamber as well too? Are you going to lose members? We sent out a survey a couple of weeks ago to all of our members, and we got great response. I want to thank everybody who took the time to actually fill out and send back that response. I believe we had 90 people, or close to 90 people, actually respond to that. Out of our 125 chambers, that's a really good response. But the number one thing, I think we're 90-some%, 92% the negotiated benefits with discounts from members. Obviously, our number one that we offer right now is Anthem Blue Cross Blue Shield. That's the most important. That's what everybody, or 92% of you, view as being very, very important. If that goes away, what does that mean? Obviously, we have other things that we offer through NOACC, but we also have to keep our chamber members excited and involved in some way, shape, or form. So, there's just so much that's out there right now that we felt like we would be remiss if we didn't bring it up and at least have this conversation with our chamber members. And we're you, you're us. I think somebody said to me earlier today that NOACC isn't all on its own. NOACC is the chambers. We exist because of you. So, as fellow chambers, we need to talk about where do we move forward? How do we go forward from this point on? So, are we talking about, is there the residuals to the chamber at 84% as well too? So, with that, do we have another slide with 2 more? Yeah, one of those things that we do want to talk about, not just the anthem part too, is, how we actually get that information to you. Your number one was personal visits. Vicki has volunteered. I've gone out on a couple myself too. We're always willing to do it. It means a lot more, I think, sometimes to your members to hear it from somebody other than you. I think sometimes our chambers sort of tune out when we're up there talking all the time, saying the same thing. Sometimes it means, or they hear it better if somebody outside of your organization is there talking. So you're just not that talking head up there all the time. So whether or not you want, Anthem to come, you want Vicki, you want myself, we'll do our best to actually get some of that information out to you and present to one of your luncheons, your business after hours, whatever it takes to actually get that information out there as well too. We have one more. And we're still out there trying to focus on getting people to join your chamber, no matter what. I mean, one of the questions was, how should we get that information out there? For the last year and a half, maybe 2 years now, we have been doing a campaign. The last 6 months or so has been a little bit more quiet on joining your local chamber. And obviously, the reasons people join the local chamber is going to be a little bit different as we move forward here, too. So, that whole key is going to be, I guess we're going to try and get some information from you as to what you want from NOACC to help you promote your chamber, to help you get people out there who are not currently part of your chamber, but should be part of your chamber, or could take advantage of some of the things that the chamber is offering as well. So with that, I guess, do we want to talk about, 80.3% said yes or possibly yes to HR or IT training. Again, we tried to be as diverse, talk about some things that we may not be offering right now, and see where we could actually build upon chamber membership for your chamber as things go forward. NOACC was designed when it was put together 18 years ago as to offer benefits on behalf of your chamber. Our biggest benefit is going away. The Anthem discount. We're 99.5% sure that that's not going to exist moving forward. And where that leaves us to be able to offer your chambers, not trying to scare you, not trying to make you go out of here and give you heartburn after that breakfast, but obviously we need to talk about it, and we need to see what you want from NOACC to make sure that we're moving forward and are able to offer you and more importantly, your members the same benefits in some way, shape, or form to make it worth your while to belong to NOACC and make your members worthwhile to belong to your chamber as well too. So lots of things to think about and to move forward on. You can see why we've had meetings going into this pretty consistently with Anthem, and they've been great to at least kind of keep us updated as to what's been changing and what's going to change. But you mentioned back there that it's changed 3 different times or 4 different times within a month's period, and it's going to continue to change as well too. So at your table, you should have a little card that's sort of sitting up. Actually, I'm going to bring Jerry up right now. You're sick, I know. You're going to. They're sick of hearing me anyway. So.
Hi, everyone. Some of you noticed that on your tables there is a table tent. And first, if I can say, Tony said something earlier that bears repeating, but I'm going to say it a little bit differently. You, all of you in this room and all of the chambers who are not represented here, are the largest organized group of chambers in the United States. And that's important. You're providing resources to Northeast Ohio as an organized effort. And why is being organized important? Well, because obviously we can bring in people like Anthem, people like Benefits One Group and IBS and Cloud9 and United Healthcare and so many other great benefits, because they want to talk to our group and get more volume for their businesses. So it's all about volume, and providing resources in volume gives people much better cost savings, much better value, and much more, many more choices. So your group is important because they provide those resources. To that end, on your tables, we have cards, and if somebody doesn't have one, is there a table that's missing? You get education. Okay. Those are areas that we would like you all to talk about amongst yourselves and come up with some ideas about how we can provide even more resources to your chamber members and your chambers as a group of organized chambers. How can you all continue to work together and provide even more? And some of you had some great ideas on the survey, but this is your opportunity to write some of that stuff down. We've provided note cards on all the tables. Write down some ideas, and I'm going to give you some hints. Can you switch to the, okay. So these are the categories. You each have one. For instance, in advocacy, okay, how can you all organize to provide more information maybe to your chamber members about current political topics that will affect them, about health care? Those are the kinds of ideas we're looking for. On education, what kinds of resources can you organize and put together that we can all as a group provide a uniform front in presenting to our chamber members through the Northern Ohio Area Chambers of Commerce, or NOACC? Financing, that goes to how you finance your chambers, how you provide those benefits financially to your members, how you help members decide where to get financing, how you maybe even help get them financed through foundations. How can we organize better as a group to provide more foundation money for businesses starting up? Those are just a few ideas. We want you to think of more. HR and employee benefits, obviously, HR, who are your people? You are a group of volunteers for the most part, but where else can we get those human resources, not only for our chambers, but for our member businesses? So there are a lot of employees right now in transition. Can we utilize some of them? Can we bring in more volunteers as a group? And again, if we do things as a group, we're more likely to get people interested. Can we use interns better? Those are some ideas in that area. Networking and events. Some of you have had success doing events together. Do we do more regional events through the Northern Ohio Area Chambers of Commerce so that we have a wider variety of faces at each event? We've all heard feedback that sometimes they see the same people over and over. Well, how do we overcome that as a group, Northern Ohio Chambers? Non-dues revenue, I think that's a category that you can probably talk for a couple hours on its own, but I'm sure you've all got ideas on that. So whoever has that topic, you can come up with some great ideas. Shared resources, and again, as a group, that's what we're all about. We are sharing resources. So what other resources can we share? Can we, and every once in a while you see an email probably from me saying, hey, it's time to buy a new business list. We can share the cost of that list, but there are lots of costs as a chamber that you encounter that you can share. So some ideas on how you can share costs and get more cost savings for your chamber. And then, of course, marketing. And that's something that we got in the feedback that Some of you said that NOACC can do a better job communicating. Some of you think your group does a great job communicating with you. But how can we do a better job communicating with you as chambers, as a group? And then also, are there ideas for how we can help you, your group can help collaborate to help you communicate with your members better? And that can be via social marketing, advertising, direct phone calls. So come up with some good ideas there. Yes.
Do you have a flyer that when we have our member meetings, we could post it somewhere for them just to start seeing the NOACC and what it...
That's a really good idea, and please write that one down. We do have materials with NOACC benefits. There is, yes, but anything that you wonder if we have, write it down. We'll let you know if we have it, and if we don't, we'll put it into the mix to get it. But yes, we do. We have a trifold that has all of the NOACC benefits. Is that still available, Vicki? There's plenty of them in stock. We probably need to update it and get more printed, but there is.
Are we supposed to write down ideas that we currently do, or are we supposed to give suggestions to NOACC?
Suggestions for how your group, NOACC, can accomplish all of these things. And it comes down to how can we better provide resources, human resources, capital resources, intellectual resources, and physical resources. So be thinking of those 4 categories of resources and how can you all collaborate together, the Northern Ohio Area Chambers, which is NOACC, how can you collaborate better together to provide the best possible resources? We already have the largest organized group. Now how can we leverage it best and be the best resource provider in the country as well? So just jot down as many ideas as you can think of. There's no limit, and we're going to collect those cards. We're not going to discuss them here. We want to allow time for the ideas. We're going to collect those and compile them and let you all know what we came up with and hopefully get some of them implemented.
We got about 20 minutes before the meeting is supposed to end. Take 10, 15 minutes, talk amongst yourself. Please write something down. This is critical. This is going to help us at least get input as to where we move in the future. So, and then after 10, 15 minutes, we still have a couple more announcements, and then we'll break. Thanks for putting some time and energy. Please put some honesty into it as well, too.
And for help also, the survey results, all the survey results have been compiled and put into your folders so you can see what your fellow chamber people have said. But those were good ideas to start with. And I also wanted to point out that we are giving the chambers that responded a $25 reward for giving us their opinion. So we wanted to put the resources towards something like that because that's how valuable this is. If NOACC survives and exceeds your expectation, which it can, there's so many things we can do by working together. So please help us by putting those ideas down. And then and we'll give you a few minutes, like Tony said, 10, 20 minutes, and then we're going to finish the meeting. Thank you. Oh, yes, and also Tarika from University Hospitals ComCare will be here, and I urge you to talk to them before you leave today, too, because they have great information that also helps your chamber members, but it's a very challenging, complicated subject.
And we're in the back. We have a, thank you. We have a table set up in the back that has some information. I didn't go into detail about what we do, but please stop by. We have some goodies to give away as well. So stop over there. Myself and Ann is here to talk to you if you have any questions. So just wanted to make sure you guys knew that.
Thank you.
I know some people have to get out of here right at 11 o'clock, so I don't want to cut off discussion, but I just want to have a couple more announcements before you leave. Thank you for taking the time to speak with one another and to write down some things. Like Jerry said, we're going to compile the information that you actually wrote on those cards. We'll get all that information out to everybody, and hopefully we'll be able to have some further discussion as to how we can move forward from here with some of the topics that you guys wrote down too. The other thing I do want to mention, there should be a flyer on your table for a fun evening, something fun and non-healthcare related. NOACC is planning another outing at Progressive Field. Take this flyer home with you. Vicki's going to actually send it out digitally as well too, so you can invite your members. Last year we had about 150 chamber members at the event. The actual deck actually holds close to 500. Obviously, you can offer, this can go out to as many people as possible. So it's a good time. I believe we are sponsoring the ticket for the executive director to actually attend. So you actually get to go for free and take advantage of it. It was fun. It was, again, a good way for us to get together in between these semi-annual meetings. Speaking of semi-annual meetings, Bright Stars is again scheduled for October, so keep your eyes and ears planned for that. We want to thank New Image Media again for filming this today. I know somebody questioned whether or not the Anthem program was going to be available. It's going to be on video. I guess you can even refer to that if you do need to get some of the information back to your board or to your members. You should be able to reference that, and that should be up within the next week or 10 days. And we also want to thank Kalahari, too. On your way out, you're going to get your $25 gift card. I think Vicki has those. Please be careful driving back. Thank you again for your input, and thank you for being a part of NOACC.